Hi, everyone. Welcome to another episode of Health Talk with Riva. I am your host, Riva. I'm a medical doctor and a researcher, and this is my co-host.
And you know me from Tech World Travels and Review, here today to do this really awesome podcast on some breaking news.
Yes. So, recently, Orlando and I were looking at the news, and we saw that Zepbound, which is a weight loss medication, has been approved for obstructive sleep apnea. And then Orlando just went off with a bunch of questions. So we wanted to bring our discussion and share it with you today. So I'm going to let Orlando start with all of his questions today.
Yeah, I do have a lot of questions on this here. And let's start with baseline questions. So what is obstructive sleep apnea so that everyone kind of understands this?
Yeah, that's a great first question to start with. So obstructive sleep apnea is one of the most diagnosed types of sleep disorders. So about 1 billion people have this, and a lot of those people actually don't know that this is what they're experiencing. And the reason why obstructive sleep apnea is very important is because it actually affects your overall quality of life, because it can increase the risk of cardiovascular disease, which means you're more prone to having stroke and heart attacks, or myocardial infarction as we call it. But you can also have metabolic dysfunction, such as diabetes, and it can cause chronic hypertension over time, which can all lead to you having a poorer quality of life.
So before we get into those things, so kind of summarize what is obstructive sleep apnea. We are basically saying this is a condition that like blocks your airway and kind of prevents you from having fluent breathing when you're sleeping.
Yes. So
just before we get into all that, with obstructive sleep apnea, can you give us an understanding how different is this from snoring?
So snoring is just a symptom, usually, of a sleeping disorder. So the term obstructive sleep apnea is the name of the condition, whereby snoring is just something you experience as part of that condition.
All right, so I'm still kind of blown away that over 1 billion people right now is probably experience some level of obstructive sleep apnea. And that's almost like 80% of the world population, which is crazy. My next question is, what exactly happens in the body? Or you could take it however you want. Like, how does sleep apnea play out in the body?
Yes. So usually what happens is the muscles and the tissue on the back of your throat, in your mouth, those tissues can lose their normal function when you are sleeping, and they can actually collapse on themselves and block the airway. In obstructive sleep apnea, it can be a partial or a full obstruction or blockage of that airway. Additionally, what happens is when that airway on the top blocks off, the chest actually has a tug effect where it tries to pull air in. So you will see that person still breathing like usual, but they're actually not getting any air into their lungs. And that's where the term, obstructive sleep apnea comes from. It's that there is no air passing through their usual airways. And when this happens, usually our nervous system, the sympathetic nervous system, which controls all of the things that happen automatically in our body, such as breathing, it will begin to fire to try to open that airway. And so usually it can help to open the airway for a short period of time, but then that collapse will keep happening over and over again. So that's usually what happens in obstructive sleep apnea.
So essentially, to like give you a picture of this here, like imagery of this here, it's someone that's lying, sleeping on a bed. They look like they're breathing, but there's a blockage in the airway. So they're actually not getting the air passage to just mimic breathing, but it's basically suffering, almost like drowning almost.
Yeah, but the time that each of these episodes can last might not be very long, and it can be shorter or longer depending on how severe the condition is.
And you can imagine if you're not getting air in your lungs in the night, the amount of damage that could potentially happen, because we know basically with air comes oxygen, and if you're depriving parts of your body or organs of your body oxygen, that could really have a catastrophic effect while sleeping. Okay, scary to think about. So moving on to the next question, how does weight loss play into this whole obstructive sleep apnea discussion?
Yes. So weight actually is a big part of obstructive sleep apnea because it's one of those really big risk factors. The reason why having a higher body mass index or more weight can affect your breathing is because fatty tissue can also be deposited around your airway, which already narrows the airway. So it makes it more easy for the airway to collapse when you are sleeping. Additionally, folks that have a higher body mass index, they usually have more fatty deposits in their chest and in the abdomen, which can make it already very difficult for your lungs to expand and keep air down. And all of these things together make your risk for obstructive sleep apnea even more. And that's why weight loss is such a big contributor to this condition.
Right. And then for folks that not aware, body mass index, you can actually get that right off most of those popular scale right now. It's basically a proportion of your age and weight to the amount of like body fat within your body. So you get a metric there that you can compare to what's in a healthy range and what's not. I know when I was in school, I used to like compete with my friends who has better BMI, they call it. And basically, it's a competition to get your BMI score higher than the other person. Okay, so my next question here is, how does someone know they're actually diagnosed or they actually have obstructive sleep apnea?
Yes. So, as I mentioned, a lot of people don't actually know this might be something that they're experiencing. And there's a really quick questionnaire that usually your primary care provider would complete with you that helps you to identify your risk of having obstructive sleep apnea. We call it the stop bang questionnaire. And stop bang because the first thing we ask is about snoring. How loud are you snoring at night? Are you if your partner tells you that you're disturbing their sleep, if folks can hear you outside of your bedroom? The second thing that we ask is tiredness. Do you feel tired during the day, even though you might have had 8 hours of sleep? Do you still feel fatigued during the daytime? The other thing is your partner might tell you that in the night you're gasping or choking, or you make choking, gasping sounds. That's another thing that can indicate this condition. If you're someone that have recently had a diagnosis of hypertension because of changes in your body pressure, that is also another factor that we take into consideration. And then B for BMI. So a BMI of over 35 kilograms per meter squared, an age over 50, and then it is more predominantly in the male gender.
Okay, so my next question here is, I've always thought that people who have obstructive sleep apnea would have to sleep with those bulky, ugly-looking, scary masks to help with the breathing overnight. I think it's called CPAP. Yep. How does the breakthrough with GLP-1 fits into those folks' lifestyle?
That's where it's really interesting, and that's really what I think they were trying to convey on the news. So GLP-1s themselves, as we know, and as we spoke about in our previous podcast, they are really great weight loss drugs. And what sets Zepbound apart from the other GLP-1s is because this also controls sleep apnea. So this is the only medication that is currently approved for that. So one of the things we do alongside the CPAPs is doctors will ask you to change your lifestyle. And one of the main lifestyle changes would also be weight loss in those folks that their obstructive sleep apnea might be related to their weight.
Interesting. So essentially what you're saying is people who have obstructive sleep apnea probably likely have a weight issue.
Yes, a lot of the cases of obstructive sleep apnea can be related to your weight.
And when you say related, that means they may be overweight.
Not necessarily, but there might just be a lot of fatty tissue around the throat, chest, and abdomen.
Awesome. Interesting. So then I guess that brings us into the conversation with GLP-1s and the different types of GLP-1s and how does that play into treating people who have obstructive sleep apnea.
Yes. So as I mentioned, Zepbound is the only GLP-1 that is FDA and Health Canada approved to treat specifically obstructive sleep apnea. But all of the GLP-1s will help with weight loss because from our previous podcast, we talked about how GLP-1s can help with that weight loss. So what sets Zepbound apart from the other ones like Ozempic is that Zepbound actually is not only a GLP-1. Zepbound actually has two compounds that help with weight loss. The first one is the GLP-1, which is the glucagon-like peptide that we discussed before, which helps to suppress your appetite. It also helps to make you feel full, and that way it controls the amount of food that you will generally eat. It helps with those cravings. However, the second compound in the Zepbound, which is called a glucose-dependent insulinotropic polypeptide, which we're going to call GIP for short, because that's a very long name. So the GIP is very specifically unique in weight loss because it actually enhances the weight loss process. It reduces the way that fatty tissue is accumulated in your organs, especially around the throat, your liver, in the chest, and in the abdomen. And over time, it maintains that weight loss.
Interesting.
Yes, so that's really one reason. The reason why this medication has shown better. Research has shown that it's better for obstructive sleep apnea. In terms of the Ozempic, yes, it does not have this peptide, but the Ozempic will help you to lose weight over time. And then I think a very interesting thing I found with my research, especially looking into the clinical trials that went into Zepbound, was that in 52% of the cases with obstructive sleep apnea, 52% of those people actually had partial or complete disease response, which means that they had remission from their disease, meaning that they no longer had this condition.
So basically what you're saying here is that this is a cure for people who might have 52% of people possibly were cured from obstructive sleep apnea by taking Zepbound.
Yeah, taking Zepbound alongside their current treatment. So the Zepbound is more like a long-term approach to treating this illness. The short term is still your CPAP because it will maintain your airways open while you are sleeping so that your airways don't close. But over time, using the Zepbound, so the studies show within 5 months to 1 year, it can actually cause this disease remission, as we call it, which is basically a cure.
Nice. So that's good news for the 1 billion people that have potentially obstructive sleep apnea. The question is, do we have enough Zepbound for 1 billion people? That's a conversation for a different day for a different pharmaceutical company. But yeah, those were my burning questions. Is there any other fun fact or anything you want to leave with us before we end this podcast?
Yeah, actually. So while I was doing research on the different GLP-1s and their relationship with obstructive sleep apnea, I realized that in one of the trials that were studying Wegovy, which are the GLP-1 pills, it actually showed that in 50% of the cases, it was able to prevent the obstructive sleep apnea in the future. So these were folks that did not have obstructive sleep apnea at the time. And over time, it showed that it reduced their chances of having this condition. And I thought that was really interesting.
Can you flush out a little bit more? When you say reduce the chances, it means that they're lower risk of developing obstructive sleep apnea by taking the Wegovy?
Yeah, exactly. So with taking the Wegovy, they did not have sleep apnea, or it reduces their chance of having it in the future.
Interesting. That just makes all these GLP-1 even more popular. If it wasn't popular before, we probably see a spike in sale. And if you do see a spike in sale, it's because of us on this podcast. So if you're Wegovy or Ozempic, you want to get in with sponsoring this channel so we can keep promoting those GLP-1s. All right, so that's it for me. Really enjoyed the discussion today. Please make sure you leave comments in the comment section there. Any questions you have, Dr. Riva here will reply directly to those questions, whether it's related to this podcast or other future topics you want us to discuss. Drop that in the comment below, like and subscribe. I'll pass it over to you to close off.
Yeah, again, just a disclaimer, like these are our opinions from the research that I have done. This is not medical care. So if you believe that from my questions or from our conversation today that you might be experiencing some things that can lead you to think of sleep apnea, please have this discussion with your doctor. We are not here to provide health advice. Anything else?
That's it.
All right. Thank you, and see you on the next one.